Welcome to the first ever Unraveling Misconceptions and Clarifying Truths in Functional Medicine event. The first part of this event is pre-recorded and will be followed by a live Q&A. But we will be live in the chat the whole time, so be sure to say hi and ask your questions. As always, the information you'll be listening to is not medical advice. For medical advice, please contact one of our Hope for Healing providers or an appropriate medical professional. Now listen as we dive into the world of functional medicine. Welcome everyone to this enlightening discussion on functional medicine. Whether you are new to functional medicine or you're a seasoned functional medicine guru, we are here to guide you as well as clear up some misconceptions and equip you with language to discuss functional medicine to your loved ones. So let's dive in. We're here with Dr. K. Dr. K is the founder and chief medical officer at Hope for Healing. But what is even more important is that she is a mother of 4 beautiful daughters, as well as someone who has needed functional medicine in her own life. So Dr. K, before we kick off and talk about all that is functional medicine, I think as myself was so impacted by your story and how you're not just someone who tells us what to do, but you live it and you experience the desperate need for functional medicine.
Yeah, just a little bit about me. I am a board-certified pediatrician, but I was the oldest of 4 children. My dad was in the Air Force. He was first enlisted, then an officer. We moved all over the place, and as a child, I was diagnosed with juvenile rheumatoid arthritis. I had waxing and waning pain, and then reflecting back, I had PANS and PANDAS as a child. Making things even, brain inflammation, fear, and then I struggled with depression that kind of hit me while I was a pediatric intern and resident. I joined the military, the Army, and that's where I met my husband, who's non-medical. And I began taking antidepressants like in 1991, and I took them off and on through 2019. And through my journey, it was a wonderful, functionally minded psychiatrist who said, you might have something called a methylation deficiency. So my journey into functional medicine began with doing my own precision genetics.
Wow.
And it revealed that I had an inability to dial down inflammation. I had something called a methylation deficiency, which leads to addiction. And that's another big piece. I was a smart person, I knew that, but you know, we all have those negative tapes about ourselves. Every single person, if they say, I don't, then they're lying. Because we all struggle with that one way or the other. Like, that was dumb, that was stupid, but then we start saying, I'm dumb, I'm stupid. So I had this inner dialogue, and I ate myself up to around 300 pounds. I was literally dying. And functional medicine saved my life. I have a picture of my jeans, a picture where I'm around 300 pounds. And, you know, I'm less than half my body weight now. And functional medicine helped me get well. So I opened the practice in 2015. And we've been blessed and added on other practitioners, but we really strive for excellence. So that's a little bit about my story.
Absolutely.
Former military officer, former very large obese person, addicted, formerly depressed and anxious, and a child that had PANS, PANDAS, and inexplicable, why do her joints swell from day to day? Turned out it was mold in military housing.
Oh, wow.
So,
well, and I feel like what is so impactful about your story is this: you were going through a lot of this all the while you were trying to help other people. And how frequently do we see that in our patients where our parents come in and they're struggling, but they're so in the care of their children that they are struggling themselves silently and not addressing so many different things.
Yes. All 4 of my children have their own health challenges. And you know, even though I began the practice in 2015, it took me a while to wean off those antidepressants. And that was under the care and guidance of another physician who's functionally minded. So in order to repair the damage of years gone by, years and years, you have to keep nourishing your body and adding in what you need and taking out what you don't.
I love that. Okay, so we came up and we did some research. We came up with 6 things that functional medicine is not, which is frequently what people can either think functional medicine is, or they are like so used to the conventional way. And then we're going to dive into a little bit about what functional medicine is. So we're going to start with that functional medicine is not a pill for the ill, whether that be medications or supplements. What does that mean?
Correct. We are used to instant gratification. Mm-hmm. And when you go into the doctor traditionally, allopathically, Western medicine, I'm an MD, you get a prescription for your symptoms, mm-hmm. but it may not address why you have your symptoms.
Right.
So, and also a supplement can't negate the effects of a bad diet. So we don't want to be supplement pushers for no good reason. Absolutely. If you haven't layered in your lifestyle modifications. Mm-hmm. So we don't just give things to mask a symptom. And many times, if you get a blood pressure medicine, then you develop a cough, and then you have to go back in, get a new blood pressure medicine.
Right.
And then you have a side effect because you're losing too much sodium or potassium, and then you end up on a potassium supplement. So it's like this roulette of medication, and that's not who we are.
Mm-hmm. We really get to the core of what is going on. Okay, so this one is really important, especially in this day and age. I think providers are frequently like they're in and they're out. So we said that functional medicine is not a 5-minute appointment. How does it look?
Yeah, you didn't get sick overnight, so we can't get you well overnight.
Right.
Plus, you are the one that's responsible for your health.
Right.
Not me, not your coach. Not your family members, you're the one. So you need to assume ownership, and it's changing the way you think and changing what your family has in the refrigerator and the pantry.
Well, in addition to that, though, when they come in, though, so this is where we're going to go into, they're coming in, a first initial visit, you do not spend 5 minutes with them.
No.
What does that look like?
Yeah, so our initial visits are such that you have an hour-long foundation visit with our health coach that helps build the timeline of your life. And when you meet the medical practitioner initially, we've read every single form you filled out. Don't you hate it when you spend a bunch of time going to the doctor, you walk in the door, you've spent an hour and a half filling out all their stupid forms, and they haven't looked at any of them.
And then they ask you the same questions again.
Yeah,
you're like, oh,
what? So anyway, our initial visits are typically an hour long. And it's not repetition of the same thing. It's a way for us to dive deep, ask more specific questions, and that's what that's about.
I love that. Okay, and this is kind of what you were alluding to, is that functional medicine is not a quick fix.
No. Again, it takes time to develop imbalances and dysfunctions in our body. It's not normal to have eczema. It's not normal to have constipation all the time. It's not normal to be anxious. It's not normal to lose your hair. It's not normal to gain weight and not be able to use it.
Right.
It's not normal to have brain fog. So we have to lift up all the rocks, peel the layers of the onion to try to figure that out.
I feel like that really leads us to the combination. So the fact that we have an extensive entry process that kind of gives us to have a deep dive into your life, and that it does come to them applying all of these things. So where it leads us to functional medicine is not one-sided. Can you talk a little bit about that?
Yeah, none of us are the same. None of us have the same precision genetics. None of us have the same background. And when we pull our emotional baggage, our belief systems into our care, and when a provider says something to you, you may interpret it one way, but another patient interprets another way. So it's not one size fits all. And so it's based on your precision genetics and how many symptoms you have and what's causing those symptoms. So it's very, very individualized.
Okay, so I love that, because that is actually not one of the ones on the list, but it is not one size fits all. And I think that is amazing to kind of understand why it comes into the connection points of
why it feels so specific, why it feels like, well, if I had this, or even though genetics look different, like from one child to the next child. But the question was why it's not one-sided. Not one-sided, meaning like, yeah.
This is not a dictatorial, it's not a doctor dictating.
Yes.
We're there to chart a course, and you're driving the boat, but we're right there with you. So, you want to get from here to there. You want what you want, but I want to give you what you want, but I also want to give you what you need. So instead of going from here to here, we may go this way, that way, this way, that way. So we are your biggest cheerleaders. Your health coaches help you modify your behavior to accomplish the way to get there within your current readiness and your current ability.
Absolutely. I think that is so important because so much of functional medicine can be incredibly overwhelming for our patients. And we'll get more into that later, but to have someone who like guides you through it. And when we were discussing this and about the event, what we wanted to do in the event is like, it would almost be like it's a choose your own adventure map, but we give you the choices in which you get to choose. So you're like, okay, so we can start here, here, or here. And based on what you want, based on what you need, and kind of coming to a common decision and mutual agreement. But then your health coaches are there to help you get to that particular change and identify why that change may be hard. Okay, the next one is that it is not symptom driven. So this one was actually really new to me. So can you describe what that means?
Well, it's kind of a plus minus with that. When a person has certain symptoms, that gives us an idea of what might be going on. For example, biotoxin illness. If you have brain fog, you're up all night peeing, your body hurts, you are in pain all the time, and your belly hurts and you can't focus and concentrate, well, right there, that is a big clue in that maybe your home environment or your work environment or your car has an issue. It's not a Ritalin deficiency. So
good.
Yeah, so we need to find out what the root cause that is making you have all those symptoms.
Right.
So we try as practitioners, and that's where we need patients to let us know, I'm not getting what you're putting down.
Yeah.
Or I get it now, why you're doing this. We need to do a good job of explaining the reason why I asked you about this is because this might be going on. And so there's a method to the madness.
Well, I feel like it was the first time for me to understand when I was going through this journey that my insomnia wasn't just because I wasn't a disciplined sleeper. My inability to do that, like it was the first time when we took a deeper dive to understand, like, I'm not the problem, but there is something in me that is not operating right.
So if your brain's not making the right neuroregulatory peptides, the right signals to your gut, to your adrenal glands, it doesn't matter what you do. If you don't correct what's wrong there, and we can, then you can move into deeper and better sleep. And
I know, right? And it was so weird to me because I think it's those lifestyle things that are so simple. The things that people are like, oh, well, I just can't sleep. It's just this. Or they blow it off because everybody has problems sleeping. And it's like, no, maybe it's just the fact there are a lot of people who have dysfunction in their body and we ignore it.
Right.
Okay, so the next question, and I put these two together because when you were breaking this down for me, I think it was one of the most enlightening things. I know you're going to say it, but I want to say that everything we're about to say in this is totally researchable, that you can take a deep dive if you would really like to understand the complexities of insurance companies and pharmaceutical companies. We are just going to touch the surface, but functional medicine is not run by pharmaceutical companies or insurance companies. And I want to add a quote that I saw when I was really doing some research on this, is that it is not that functional medicine doesn't accept insurance. It's the fact that insurance does not accept functional medicine.
Yeah, that's
so can you
true.
unpack that?
Yeah. So, for many, many years, I practiced in different medical venues. I was a hospitalist. I was in private pediatric offices, Texas Children's Urgent Care, etc. And when you have certain diagnoses, you have to justify within the body of your note or go through a prior authorization procedure in order for the insurance to approve what you're doing. So essentially, non-medical people sitting in offices that don't care about you as a person are dictating, telling the doctors what they can prescribe, and you have to use up all these so that you can get this. You know, migraine headaches are an example. Have to try this, then you try that, then you try this, and then, oh yeah, now you'll qualify for your Imitrex, your sumatriptan, or whatever. So I chose to step out of that because I didn't want someone to tell me how to practice medicine or to have the handcuffs of a pharmaceutical company or an insurance company to tell me how to practice medicine. But we do hold ourselves to an incredibly high standard.
Absolutely.
Ethically, medically, legally. We want to be excellent. And we're also under a microscope.
Yeah,
we
absolutely.
have gotten insurance to pay several things that we didn't think they would.
Right.
And it's like you do the happy dance. It's like, I got that neuroquantum MRI approved via insurance. Thank you very much.
I love that. Well, I also think for me, when we were going through that discussion, one of the things that you mentioned is that there are actually certain insurance companies and pharmaceutical companies that are owned by the same. And so it's like, okay, well, clearly you're going to want to prescribe things. So that feels like conflict of interest, which you avoid in a lot of other like jobs and stuff. So, and then the other thing was when you were talking, it made sense to me. And just being really honest is that I was diagnosed with fibromyalgia, and that's a whole nother talk for a whole nother time. But I was diagnosed with fibromyalgia. They put me on a medication that I remember waking up and going, Christopher, I want to kill myself, but it's just too much work. And like, that would be too much work. And I remember him going, okay, well, we need to talk to a doctor. And their response was, well, we actually have to get through 5 other medications before we can get to one that we actually think. And I didn't know why. Like, no one tells you, well, the insurance company won't let me. No, they're just saying, well, we have to go this way. And I was like, but that's scary for me, right? I was like, I loved my life. That was, yeah. So anyway, that really just changed. Like, there's something probably more out there that I don't understand.
And no one searched for the cause of your fibromyalgia, which was Lyme disease.
Exactly, right? So we had no idea.
Yeah, so all those medications would have potentially helped with symptoms, but obviously it made you suicidal.
Exactly.
So it's like, we just don't know what we don't know.
Exactly.
And so, yeah.
Okay, so we've talked a lot about what functional medicine is not, and so I'm really excited to talk about what functional medicine is. So can you give me a short definition of what it is, and then we'll pack some other things?
Yeah. Well, functional medicine is a 40,000-foot view at all the systems of your body. Instead of going to the cardiologist for chest pain, going to the gastroenterologist for blood in your poop, going to the pulmonologist for your difficulty breathing, going to the endocrinologist for your weight loss or your type 2 diabetes.
Right.
It's putting it all together and saying how all of your symptoms may be related. Can we find 1 or 2 reasons for why you have all these symptoms?
Yeah.
And then trying to find out and move your body towards balance. So it's what we call a systems biology approach, where we look at everything, try to put it all together, and find some evidence. So we order LabCorp labs. We try to use your insurance. If you have a health sharing group or don't have insurance, we have negotiated fees and prices that are even better than if you walked into LabCorp and said, I don't have insurance. Then we put all that together. We try to find out what the problem is. So it's not dysfunctional and it's not disease management. It's trying to help you have vibrant health. And health is not just the absence of disease.
It's not. Okay, so I heard it said once that a way of communicating about functional medicine is that it's an inflammation hunt. Can you break down what that was alluding to?
Yeah, so I don't know about you, but if I have an infected bug bite on my arm, it's hot, red, swollen, painful, full of pus. And pain of any kind, okay? Neurological, emotional, spiritual, physical is a lack of oxygen utilization, it's inflammation, it's mitochondrial dysfunction. It's like you're not making the energy you should. So inflammation, you have to find out what is causing your symptoms.
Yeah.
So we're looking for infections, we're looking for toxins. Many infectious organisms make toxins. We're looking for vitamin deficiencies, too many of certain vitamins. So it's a balancing act. So if you're sitting on 3 tacks and you take one away, your butt's still going to hurt because you've got 2 more tacks in there.
Right.
So it's taking out everything that's causing you pain and balancing things.
And I love the way you describe functional medicine because so much of, or inflammation, because so much of inflammation is actually invisible. So can you talk about that?
So many people get gaslit, meaning you go to the doctor, they look at you and they go, you look just fine. But inside you're dying, or you wonder why you have all these symptoms. And then you feel dismissed and you don't feel like what you say has to matter. And if your traditional inflammatory labs like Cedrate, ANA, C-reactive protein are negative, it's like, and your white count's not elevated, it's like, oh, you're fine, there's nothing wrong with your labs. But then if you have non-traditional functional medicine labs, either via LabCorp or subspecialty testing, we're looking for all that. So you look for stuff in the gut, you look for the environment in your home too.
Yeah, so it's like we don't always see what is going on. And then also I remember, yes.
Okay, inflammation. So I forgot to say, at the foundation of what we do is nutrigenomics. On our precision genetic testing for you, where we put it all together, how you show up at the table genomic wise, is if you have an inability to dial down inflammation that you were born with, and if you have an explosive immune system that you were born with, how can we modulate that? So that's the cool thing. God always builds backup plans, ways to get around something that may not be functioning correctly, that predisposes you towards autoimmunity or pain or mental illness.
So this actually leads to one of the other pillars. So this is a perfect segue. One of the other pillars that we talk about. So we talk about genomics, we talk about the medical piece and the diagnosing and all of the testing. But another piece that we have that is very important is lifestyle. And coming into that. And so 2 things that I really leads to the story, and then I'd like you to unpack a little bit more, which is I remember the first time coming in and our providers looking at my symptoms and not just saying that was age, or that was just because you're stressed, and being gaslit. And I remember understanding for the first time, feeling like somebody actually thought I was sick. And I went home, though it was really overwhelming at first, I went home and was like, there was almost like a slight relief of that stress. So it's like, it was that moment of momentary feeling better, even though we had started no procedures, because the stress of finally being heard and taken seriously had diminished. And so anyway, can we talk about lifestyle and what that looks like and why that's another very important pillar before everything?
Right. Being believed, being seen, and being heard, that's what we all want. We want our spouse to look at us and listen out to us instead of looking at their phone.
Right.
You know, we want our parents, when we're children, to acknowledge us. And so what you bring to the table and things that you can do, but maybe you need help getting there. And I'll just face it. Before we had health coaches, many people crashed and burned, and then they were frustrated and they left. And it's like, I paid all this money and nothing worked. And that's because no one was there to help them with the nitty gritty of the behavior modification. And I think this, as a parent of 4 children, 2 grandchildren, and thinking, oh my gosh, how can I get my family to buy in on this? I was pitching Tupperware and moving to glassware and silicone, and they were like, what the heck are you doing? I was taking the sugar and the flour out of the pantry. No, we want that. And it's like, no, you're killing me. It's like alcohol. So how do we get there? Lifestyle, nutrition, and water intake. That's very important. People will say, oh, I'm gluten-free, I'm dairy-free, but then I find out they're eating cheese and corn. And corn is gluten cross-reactive. how much movement are you getting in? You don't have to join a gym. You're going to crash and burn. All you got to do is move.
Absolutely.
And then your stress. You've got to deal with your mental, emotional stress. So many of our patients have sexual trauma, spiritual trauma, emotional and mental trauma, and a lot of it they do to themselves. So there's a system in our body called the limbic system. Limbic training, like going to a good therapist, doing EMDR, doing brain tap, doing things to help you identify your self-limiting beliefs.
Right.
Not a bunch of woo-woo. You can find good people,
Absolutely.
good clinical psychologists. And then we talked about movement, community. You want to have people who are not Debbie Downers and toxic to you. And then we added in 2 more modifiable lifestyle factors, which are your time and your finances. Because if you're going to therapy for your autistic child, but you're driving through Chick-fil-A and you may be spending $382 a month,
right,
you could take that and put it towards your functional medicine care path. And so I think I left one of them out, but that's those are just the things that we can do ourselves. Those are modifiable lifestyle factors.
Well, and I can't help but say, so as someone who leads our group coaching, to see parents and to see patients get better and their symptoms start to diminish. So it feels like we've almost, like we come in and I call it puffballs of pain. I was a puffball of pain. And even with the beginning, when the providers would talk to me, ask me questions, I was like, what hurts? And I'm like, all of me. So I was a puffball of pain. But once we started to apply lifestyle, and the way that I see our group coaching participants and clients, like they will do it, and our patients will break down this process. They're no longer puffballs of pain, but they have points of pain. Now we actually can identify, actually it's my joints that actually hurts. And it's like, oh, okay, so now let's look at it. So by the time they see y'all, they can have that communication of going, hey, I'm not just this big puffball of pain, but I can target, I can talk to it. And now we can hone in. And so not that it's easy, right? So it's not easy, but having a health coach come alongside you, being a part of a community with our group coaching can be that pivotal place. And honestly, it's probably one of our lowest entry rates that we can just come in and start addressing so we can target what they're going through.
And getting the family on board. Also, we've got a male health coach now. So if you're having trouble convincing your husband, got a male health coach. Sleep and restorative time is the last modifiable lifestyle factor.
Which we touched on, which is really good for sure. Okay, so we're going to break this down into 2 different questions. So when I talk about functional medicine, who is functional medicine for? We believe that functional medicine is for everyone, but can you talk about how functional medicine is for the chronically ill?
Yes. Well, functional medicine, as we discussed previously, is seeking to find a root cause or causes. Toxin, infection, everybody has infections. And so we're digging deep to find that. And we don't want you to go through the rest of your life chronically ill. I have some people on the other side, and they've gotten their jobs back. They're no longer on disability, and they're thriving. And that is that's great. And it's if we can get you healthy out the door, and then you come back once a year for tweaking, refill your low-dose naltrexone if you need it according to your precision genetics or what you're presenting with, then so be it. We're not trying to continue, although we want you to stay with us because we love you.
Absolutely.
But then for people who are, so that's for chronically ill.
And then what transitions into, I feel like, and so I use this question very sparingly versus saying, how is it for healthy people? How is it for people who currently feel they are symptom-free?
Yeah. So, we are so used to suffering in silence that, we think that our low-level anxiety is normal, or we think that the occasional insomnia is normal.
Right.
And so for people who don't have a disease, health is not the absence of disease.
Right.
So if you don't think you have a lot of symptoms, we can give you principles to help optimize your body. And if you've got a family history of cancer, type 2 diabetes, autoimmunity, do your precision genetics. It's like your owner's manual, and then you have what you need to go through life to set yourself up for a lesser chance of chronic illness for developing. So did you know if your body is alkaline, cancer can't grow in it and cavities don't grow?
Wow.
So how do you develop alkalinity? That's what we talk about. How do you have an alkaline lifestyle? So you can always make the best thing. Or if you're a man who's losing your hair, let us see why you're losing your hair by one of our genetic panels. We can give you what you need to hopefully promote hair growth.
Exactly.
So we want to set you up for success using an owner's manual so that you don't end up like your grandparents.
I think that is such a good thing to point out, because I do believe that there are a lot of people who are selling quick fix hair growth supplements, and that can be, one, really dangerous, because you don't know what is going on with your body, you don't know why this is happening, but two is that there are panels. Like, I think sometimes when people come in and it's like, hey, like, I know there's probably something bigger that I'm struggling with, but I really just want to lose weight, we can help that alongside figuring out what's going on. I didn't know that my weight gain was so much, or why losing weight was so hard, that it had to do with my Lyme, and that those two symptoms are working together. I'm like, okay, so no matter how hard I worked, it wasn't going to do what I needed it to do.
If your brain is telling you don't lose weight and hang on to your fat fat cells keep making something called leptin. And regardless of what you do, it won't go away, especially too if your environment is not necessarily conducive to the inflammation in your brain going away.
Right.
So it's not your fault.
Okay, so now we're going to transition.
Okay.
Now, we did a whole lot of research on not only coming from the perspective of providers and where the providers can get frustrated with functional medicine, but also patients or people who have looked into functional medicine. They just have a lot of concerns. And the more and more we dug, we felt like these were really valid and needed to be addressed. So we're going to start off with the aversion that people have to functional medicine is that functional medicine takes too much time, and functional medicine is just so much longer than conventional medicine to get results. Can you unpack that?
Yeah, that's true. It does take longer. That's because we're not trying to manage your symptoms. So it takes a little bit to determine, okay, what's your home environment like? Is your workplace conducive to healing? Did your car get standing water in it? Is that making you sick? Is that why your face swells up and you get hives every time you get in your car? So we're digging for those infections, those imbalances, and it takes time. And that's why we look at your entire life. We run all these tests. We try to put together an action plan, and we can't just do that in one visit. So that's why we ask people to join us for a year. At least a year. And some people it's going to take longer to get well.
Absolutely.
The longer you've been sick, and also what your body can tolerate. And if we have problems along the way, let's say a therapy is working, but the therapy is making you feel poorly, and that's because bugs are dying, then we have to back off a little bit and help you get through that. So it's helping you be able to live life in the process and not be completely bedbound.
Exactly. Because we know that there are patients, and that's where you use this word, and it's my favorite group coaching word, is that really understanding what each patient's individual current ability looks like, because it is different. And so for those of you who have the ability to just slam it down hard, do all the things, but like for me, that is not my story. Like, that was really hard on my body, and I've tried to do all the things all at once, and when we started a low and slow approach, it was also less stressful. And I think that the lack of stress provided almost like my body was a safe place to heal, and it created safety there. Okay, so we are going to hit all the hard-hitting questions, and this one is one of those. So this is one of the aversions, is that doctors who practice functional medicine aren't real doctors because they can't prescribe medication and won't if it's needed.
Okay, well, all the medical providers in our practice are licensed medical providers in the state of Texas, either an MD, DNP, FNP, or PNP. And we all write prescriptions for medication because if you have strep throat, well, by golly, we're going to treat it because it can cause an autoimmune attack on the heart or the brain called rheumatic heart disease or PANDAS, brain inflammation. So in our practice, that's the case. There are many people who call themselves functional medicine practitioners who understand the principles, but they're non-prescribers.
Right.
So that's why you need to research it. So you may see an excellent functional medicine trained licensed acupuncture therapist that cannot prescribe medications.
Right.
You may see a chiropractor that is brilliant, but they can't prescribe medications. So you need to do your own due diligence.
Right. And that's kind of, and we talk about this a little bit later, which is knowing what you want and knowing what you need. So if you want someone who is, because calling yourself a functional medicine practitioner isn't something that, I mean, a lot of people do and a lot of training can have, but all of ours in Hope for Healing, again, just speaking to it, are all licensed and able to prescribe.
Yes.
Which is really cool.
The other thing is that part of becoming a team member here is being certified through the Institute for Functional Medicine. And one of our practitioners who, she's certified through the American Academy of Anti-Aging Medicine, A4M. But, you know, we continue to train ourselves and learn because we're learning new things all the time. And so that's part of this.
I'm in that provider chat, and just to see the articles and the ways that you'll share the, hey, this is going on with patient number, blah, blah, blah. How can we dive in deeper for this? Or, hey, you know what? We need to create a chart that helps to make that easier. And so though we can't make this statement overall, we can answer the question according to the way our practice runs.
Prime example of that, you know, we have many women of childbearing age and they don't want to take birth control pills. So we were talking about, should you use a copper IUD or a hormonal IUD and what you need to do to optimize things, and researching that and putting all the evidence into that. And so we're all learning things every day. And I'm a pediatrician talking about IUDs. Okay. All right.
Right.
So
I love that. Okay. So this is a two-sided question. So the fullness of the question, or the aversion, is that functional medicine isn't real medicine, and there's no proof that any of this works.
You know, that's kind of disturbing to me. And you know, when my colleagues who have seen me, they're like, Paula, what happened to you? And I'm like, oh, we're very scientific-y. So the Cleveland Clinic, which is in Cleveland, Ohio, opened the first functional medicine clinic in October of 2014. And within a year, they had over a year-long waiting list, and then they expanded, and now their clinic is 18,000 square feet.
That's amazing.
They had funding to do studies from the very get-go. We have shown using questionnaires and what we call instruments that show that functional medicine has better outcomes. And if, you know, the patient would spend as much time with the nutritionist as they would with the provider.
Right.
We do it a little differently here. Our health coaches talk about nutrition, but it's very evidence-based, and you can go into PubMed and look at that. And you know what? Who wants to be a part of a big study? What about the N of one? I'm the N of one, meaning the one person that functional medicine saved their life. Even when a doctor looked at me and said, did you really get suicidal? That made me feel like crap. I never went back. Never went back. Gaslighting.
Yeah, gaslighting is so hard. And I also think it's super common now, especially because if you have a degree, you have the right to say or do whatever. And at Hope for Healing, we just don't operate that way.
And you know, it comes down to pride.
So
Physicians have had a lot of education, or medical providers, and it's also scary when you don't know what you don't know what you don't know.
Right.
And it's all about being a lifelong learner, humbling ourselves, and being willing to hear and listen. And typically until your own life crashes and burns in front of you, or your child crashes and burns, do you even open your mind to something that is not familiar to you? So it's all about being open and willing and humble and being a lifelong learner. And you know, that's something we all have to come back down to every day.
Absolutely.
And, many times I've had very ugly things said, quack this, quack that. And I'm like, but Dr. So-and-so's child is seeing me and they're getting better. And, and
absolutely.
We have actually had referrals from one of our local premier children's hospitals, which there's no higher honor.
Yeah.
And especially when we can figure out what's wrong. When kids and adults have had the $1 million workup and no one knows what's wrong.
Right.
And then we are able to go, here it is. Yeah.
I do want to say, and though we 100%, we do understand for those of you who may have tried functional medicine and it didn't go as smoothly. I would like to say we can only speak from our own personal experience and really because I think the brilliant minds that we have working here love learning and love to have evidence-based. And so that is how we run. So if you have had trauma with the functional medicine practice and maybe they just only threw essential oils at you and they didn't take it or you wanted an antibiotic, first off, we're sorry that was your experience, but it is so important to us to operate from a place of integrity, and a place of integrity comes from knowing that what we're trying is something that works and have seen it work, and maybe that may not work for you, but that's what I think I love about this practice. We aren't sold on this is the vitamin D you need and you have to use it. If I came in and said, hey, I know you said there shouldn't be any side effects, but for some reason I am, fine, let's try something else. We don't just again, gaslight you into being like, it's fine, you can deal with that symptom. We look constantly for other things. And I feel like, I know that's not everybody's experience and wherever you are and wherever you've been, but whether you want to come here or you want to go somewhere else, or maybe you're in a different state, I want you to know that you can look for that and you can hold your providers to that accountability to be able to care about you. Right. And so I just felt like that was really important to say.
And if you're feeling that, say it.
Yes.
We can't read your mind.
I love that.
And this is collaborative. And we don't know, we can't read your mind, so please tell us. If you've been hurt or you feel like you're not heard, tell us.
Well, this kind of goes into this, so I'm actually going to jump to this one, which is functional medicine is just another doctor telling me what to do.
No, we were just talking how we chart the course and, utilizing the health coach and where you're at, finding out what you're ready for and what you're able to do, your current ability, your current readiness. And, you don't have to do anything we say or recommend. But we're going to give it our best clinical decision-making and medical decision-making to tell you this is what we need to obtain actionable intelligence in order to move you from here to there. So we want to work with you.
I love that. Functional medicine is just too complicated. I don't think I can figure it out.
Well, it is pretty overwhelming.
Yes.
It really is. So, but, we seek to try to simplify the journey. And that is another reason why health coaches are so helpful. Because when you look and you go, I can't do this because of that. Or I have 3 children, I have 3 drop-offs and pickups. How in the heck am I going to get that binder in 2 or 3 times a day while we're trying to get our home remediated? How can I cook this food to nourish my children's bodies? How can I do this? I can't. That's where we want to come alongside you and take a deep dive as to where the problems are and give you tiny steps in order to just move from here to there, here to there. And you know what? Rome wasn't built in a day. Right. Something is better than nothing. So we want to help you do what you can do.
Absolutely. And the deeper that we start to walk through that, we, within group coaching, we'll literally talk about the biology of when you start to make this simple decision that feels like it's not going to do that. And we can literally map, this is a high needle mover, this is what is in your current ability, and finding your golden behavior. And once we go through that, the more you start operating in this, things that are in the category of I can't do it turn into I can do it, because you've really start to change the way you see things, but also because you start to feel better, right? So you start to feel better and you're like, I couldn't do this, but now like instead of being in pain 24/7, I have moments. So now I can do, and it continues to be that process.
Right. Who would have thunk that my gluten-free mac and cheese, the dairy, is what was causing my constipation, diarrhea, and eczema?
Right.
You know, and it's
you never would have known.
You never know. So, and getting the family on board so you don't bring the enemy into the house. But group coaching gives you all kinds of tools to be successful.
Absolutely. Okay. So this is the last one. And like I said, we are not straying away. So the last question is, functional medicine is expensive.
You know what it is. But what's the value of it? And when you think about the lifetime that you're going to spend money on something, let's use an example that many people deal with. Your child's diagnosed with attention deficit disorder.
Right.
They meet a list of symptoms on a sheet of paper, the Vanderbilt questionnaires that the teachers and you as parents do. Your pediatrician says, hey, your kid has ADD. Let's start with this one. Well, you realize it suppresses their appetite too much. So you go back to the doc and you say, hey, this doesn't work. We need to try something else. So every 3 months you're going in for your medication refill, and some of them are controlled substances.
Right.
So that requires extra money. And then, you know, you're also getting your occasional labs and your EKG and these other things, but you're on this drug roulette.
Right.
And if you map that out from age 7 until age 18 or into adulthood, how many copays have you paid? How many copays for doctor visits and prescriptions? And you still don't know why your child has ADD.
Right.
Is it because their neurotransmitters need dopamine production going on? Do they need lithium orotate? So if you invest up front, and that's the thing with functional medicine, it is a lot. And you're investing, but the return on the investment is a lifetime investment.
Absolutely.
And for some chronic illnesses like inflammatory bowel disease, Crohn's, ulcerative colitis, you know, instead of having to be on a biologic agent the rest of your life that suppresses your immune system, makes you more prone to develop leukemia, and you have to be sure you don't get tuberculosis along the way.
Exactly.
Then it's still not dealing with why you got it to begin with.
Exactly.
So it's an investment, but it's also the return on the investment, the value that you get. And I'm going to go back to the genetics. That's what saved my life. That's what saved me and allowed me to know what I needed, what I didn't needed, and I didn't have an antidepressant deficiency. I took 11 to 13 different antidepressants through all those years. And, you know, the regret, the remorse, and, you know, I didn't know what I didn't know.
Right.
Who would have thought that throwing in certain nutrients on a daily basis, consistency is key, is what would help me make enough dopamine so that I would have balanced neurotransmitters.
That's amazing.
So, yes, it is expensive,
Yeah.
but it's valuable.
Right. And I feel like where we're a little bit different when we decided to put in time and finances was because the number one thing we see when people say that it is too expensive is because they're trying to do everything all at once. That instead of just saying, hey, I'm going to start here in my current ability, I'm going to do everything, and the only way that I can get better is do everything. I am like poster child for trying to do everything because I just really wanted to be better fast, and I was more miserable. But when I started to go low and slow, I started to see pockets of health. I started to see my stress levels were lower. I started to see a change, and I'm still on my journey, but to see it that when we tried to do everything all at once, and when we did that, we actually caused more stress, more inflammation, and then it was more of a financial toll. And then, so I think sometimes the people's fear is that I'm not going to get better if I don't do it all. Can you speak into that?
Yes. You know, I used to order all these tests and do 90-minute initial visits. And a lot of functional medicine practices will order thousands of dollars of tests even before they see the patient. But what if you move in an intelligent sequence and start with decreasing inflammation first?
Exactly.
All those gut symptoms may completely go away by the time you end up seeing the medical practitioner.
Exactly.
Or they may be a lot less. So it's baby steps, a few steps at a time. And that really kind of goes against a lot of the functional medicine training. It's like all disease begins in the gut. Yes, it does. Do the gut test first. Well, what if your brain is telling your gut to be leaky? Wouldn't it make sense that we correct the imbalances in the brain in order to correct the gut? And when that happens, that's what happens.
Right.
So an intelligent sequence, but it's based upon the patient in front of me. If mom and dad tell me we're both chemical engineers and our child is autistic, and then I may say, okay, let's check those first, provoked urine heavy metals, and then they come back high. Those heavy metals are going to impair your child getting better, so we need to get in there, take care of those in a non-harmful way while we're lowering inflammation.
That's so good.
There's more tools in our arsenal now. I had a patient that went to another practice, and they ordered over $7,000 worth of tests. They didn't even look at what she had had already, and she had some of those, tests done already.
That's amazing.
And it just grieved me that they paid all that money because those practitioners did not look at what they had already invested in.
Absolutely.
So we want to honor your finances, your hard-earned dollars, and the time that you spend with us. We want it to be very valuable.
Though functional medicine can be expensive, or can be, it's a higher dollar item. Though that's the case, I know we have two patients that we're not going to name that we really want to kind of break down, where though functional medicine can seem a lot more expensive because we don't take Insurance, yes, because we don't take insurance, it is not actually always the case. Right. And can you discuss those two?
Yeah. First is a child with dermatomyositis. They came to us and had precision genetics, and we identified some issues. And this patient was taking a very expensive biologic agent. And what they invested with us was so much less than what they had been paying for their copay for their biologic agent. The other is a child that had alopecia totalis, and we have a release, and we discovered, and this child was on Dupixent, and they had lost their hair, they had celiac disease, alopecia areata, well, actually totalis, and were on Dupixent. And 4 months out of the moldy home,
right,
full floppy mop of hair, no more Dupixent.
So take a look at this right now. You can see the picture.
Yeah. And then real quickly, lastly, a young patient that had struggled with constipation intermittently and had gone to, over the last 8 years, to one of our premier children's hospitals, been treated for terrible constipation with Miralax, in and out, clean outs, lost work for the parents, going to the hospital, going back, x-rays, and 2 modifications. The family was already gluten-free, but they went dairy-free and added in an anti-inflammatory supplement called PEA, palmitoyl ethanolamide, and that helps inflammation in the gut and the brain. And that greatly improved the constipation.
Wasn't she one of our group coaching
yes,
also?
She said, if I would have known 8 years ago that I could pay for group coaching, PEA, and take out dairy, it would have been worth that many times over.
Right.
So we're still on that journey. But hey, those are real. Those aren't made up.
Nope. Okay, as we wrap up, we know that this was a lot of information, and in that information, it can be really overwhelming to go, okay, I know everything now, or I have a deeper understanding, but maybe there's still some overwhelm after all this information, and maybe you want to do your own research, and we are advocates for doing your own research and asking questions, because we do it. That's what we do. That's how we become who we are and how we become more educated. So I want to address that. But what are 3 small things that people could start with?
Great question. If you still have questions, go onto our website, get to theroot.com, upper right-hand corner, schedule a free welcome/discovery call. Even if you're a former patient and you've dropped out and now we've changed our model with our health coaches Yes, you need a health coach. I need a health coach.
We all need health coaches.
Yes, we all do. It's behavior modification experts, behavioral psychology experts. So just schedule a free welcome call. Second, if you like in what you hear, and consider group coaching. There's a curriculum that we've made. It's available to purchase at our office for $50, the book, and you can start that journey. And for what you get to move you from here to here, it's well worth it. Plus there's community, and we all need community in this world that is so, just do it over the phone.
Absolutely.
It's like I lose something if I can't examine you, see you, touch you.
Absolutely.
Third, think about your precision genetics. If you want to start someplace but you don't want to get with a medical provider yet, you can think precision genetics. But what is something you can think of, Lauren?
One of my favorite things, because, well, it's what I do here at Hope for Healing, which is our events. We have so many free events in October. We have another movement. I think we actually have 2 more movement events coming up. So you can join any of those, and we have them. Follow us. One of the freest things that you can do is follow us on social media. We're on all the social media platforms you can think of, so you can see when free events are coming up. You can see when we have sales on things. If you're wanting to look, we have it. We love partnering with our patients. So we don't have sales. We have patient thank yous. Like, patient, thank you for being our patient. We want to be able to provide that.
Before you wrap up, the other thing I was going to say was, well, you're interested, you like what you're hearing, you want access to these things.
Yes.
You could even become a member of the practice.
Yeah, you're right.
You could become a member of the practice. It's $199 for 1 year for the first person. Say you're a mom and you want to get more information.
Right.
You have access to our private member Mighty Networks community, and you can access our previous video events and other things that we've posted: anti-inflammatory breakfast, lunches, dinners, snacks,
recipes,
our
discount codes. You also get 5% off on functional therapies and supplements.
We just can't offer medical advice if you haven't established as a patient to be a medical patient. But hey, it's a foot in the door.
Yes.
And think about $199. You know, it's about 3 months worth of Starbucks drinks and a couple of drive-thrus. You know, it's like, woo. Anyway,
exactly.
55 cents a day.
Yes.
So, for a year.
So thank you so much for listening to the recorded portion of this event. Now we're going to head to our live Q&A. So yeah, are we live? Okay.
You will be.
Okay, perfect. Okay, so one of the questions that we have coming up is, I don't want a health coach and I don't really feel comfortable with a health coach. So can you really talk to me more about why you brought health coaches into your practice and how they can benefit me?
That's a great question. I would say this is that the most difficult thing is application of what the recommendation is and behavioral change, because applying what you've learned, most people say, well, I can do this myself. I'm going to pull myself up by my bootstraps, but they get stuck. And they don't think about the fact that there are a lot of things that are blocking them. And the health coaches are ingenious in distilling out why someone can't move forward, or what their beliefs are around something, or what is stopping them from improving. And then that will, at a much more reasonable price point, also with someone holding your hand, walking you through this journey, you're not sending numerous portal messages that a health coach can answer and tease out exactly what the problem is. So health coaches have changed the trajectory of how fast our patients get well, and doing it within their own personal readiness and their own personal ability.
Yeah,
and
I love that.
It helps prioritize those, because if your brain is inflamed, a lot of times you read something and you just pick and choose what you want to do, and you don't even realize you're not following the right intelligent sequence and right order of things to get well.
Right. And I think what's really cool is our coaches also are really great about hearing, because they're so good about like the behavioral changes and stuff, they can also hear your hesitation to be able to come back to the provider. And it really is this collaborative communication of, I'm actually not ready for that. Is there another step I can start with first? And they can keep that conversation going and kind of field out your fears.
Yeah. Or, you know, you've had an appointment and you kind of go debrief in the IV room and the IV nurses are like, you know, you really ought to send a portal message. And we don't know what we don't know. And we don't know what those problems and those things that are stopping you from improving are. And so we want to partner with you, and the health coaches are like glue. They keep you going, they hold you together, they hold us together, and they move you forward.
Okay, so another one is, my budget is tight. Can the provider work with me to only do the most important things, or are you one of those places that everything is important, so I have to do everything all at once?
We're the prior, because we have lots of people that have lots of children and they're sick and tired of being sick and tired and they want to move forward. So yes, you just have to say, this is not within my current ability. Dr. K, what are the most important things? And that's something I try to emphasize. I said, in a perfect world, if you could only do X and X, like if their home is moldy and it's like, take your fish oil, take your binder, and you need to put your finances toward finding a clean dwelling,
like
or
a safe place,
a safe place to recover and to heal. And then if you're like, that's impossible, don't have this closed mindset. Think, okay, if I could get out for 2 weeks, what would that look like? Where would I go? And we can help you with that.
Yeah.
We can direct you where to go and what to do, to like see that there is light at the end of the freaking tunnel. So,
what are the most like typical things and types of patients you see at the practice?
I would say, as far as kids go, we have very, very healthy children that have been with us since birth, that have done precision genetics. But then the most common things as far as sick children are like ADD, ADHD, irritability, emotional lability, brain inflammation. And then with adults, it's fatigue and brain fog, cognitive decline, and hormone dysregulation. Those are some of the most common things. But we also treat a lot of vector-borne illness, which is Lyme disease, Bartonella, Babesia, that kind of thing too.
Yes, yeah, that's a lot of what we see. Well, a lot of what we see in people not knowing. So they come in very caught off guard sometimes, which could also be really overwhelming, which is why the health coaches are super helpful to be a part of that process. Okay, so one of the questions we have, because we do therapies in office, so we're not one that has to outsource therapies, what is the difference between like my IV that I'm getting now with vitamins that I still take, but like what is the benefit of getting IV therapy?
Well, if we've evaluated you and we determine, you know, you're profoundly fatigued or you're very, very deficient in these certain vitamins, when you do IV therapy, it goes straight into your bloodstream and it's bioavailable, meaning it goes into your cells. So we're saturating the receptors throughout your body. It's like all going in, it's all being used. Whereas depending on the health of your gut, only a certain percentage of what you take orally may be resolved or absorbed. Excuse me, I chose the wrong word. But that's the advantage. And you know, if you're fighting an illness, man, vitamin C will turn you around, an immunity drip will turn you around very, very, very quickly.
Well, I have a question that kind of almost goes on top of that, which is like when I'm having when my gut biome is still not going well, will IV therapy help where supplements may take longer to help, right?
Yes, absolutely. So I think that is, you just said it.
Okay, I just wasn't sure.
It's like IV therapy is going to all be absorbed, whereas if you're still suffering in your gut, that, you know, not as much will be absorbed orally. That doesn't mean you pitch your oral supplements at all, but what you get IV is so much more beneficial. And we really try to tailor it to the patient and what their needs are, and we're very transparent about that, and that is not what you get when you walk into some of these standalone places.
No.
And they don't tend to warn you about, hey, you're having IV vitamin C, you need to eat a really good high protein, high fat, appropriate fat meal. or your electrolytes, or your blood sugar will go down, and you know,
Feel woozy.
yeah, and we get your medical history and we tailor it to based on who you are, and that's what bothers me about some of the standalone places.
Absolutely.
They don't have clinicians.
Kind of
in
dangerous.
there. Yeah. Yeah, it's true.
Okay, so the last question we have is, we've talked a lot about precision and like the precise things that we do with medication and with supplements. But one of the questions is that why or how, I don't really know how to word that on this end, but why can't certain people eat the same thing? So why does that part have to be precise?
Yeah. Well, you know, some people have guts of steel. Other people do not. And it boils down to your genetics, because you can actually be born with a leaky gut. So there is something that's secreted. It's called fucosyl-transferase. If you're heterozygous or homozygous for that, you are born with a leaky gut. So there's no protective barrier when you come into this earth. Even if you're born vaginally, your mom feeds you breast milk, that you, if you're not getting a good amount of probiotics in there, that protective layer, that stuff protects the gut with. So the other thing is we test for celiac, and we test for dairy, lactose intolerance, and casein and whey, which are the proteins in dairy, if you're sensitive to that. So some people aren't and other people are, but a lot of the people who come to us are. And if you can be proactive and not develop celiac disease from the precision genetics. I have a family that came and their child was tested, they moved away, then they came back, and they came back before their child was 3 years of age, and that child had failed to thrive and had developed celiac disease. And there was a lot of shame attached. I'm like, you know, just stop the shame, stop the guilt.
Right.
We have learned as practitioners now to be very candid, very forthright, and tell you the truth. If you don't stop giving your kid gluten, there's a 30-fold chance they're going to get celiac disease if you don't take it out of their diet. It's not a guess, it's a no.
Right.
1 is 10%. And so we want to help you stay healthy, and that's the beauty of an owner's manual. So
Okay, so I think this may need just a little more explanation, because when you explained it to me one time, I was like, oh, this makes sense. If this person is gluten sensitive, right, which means they do not have celiac yet, right? So luckily what is the big deal if they actually get celiac versus just being sensitive?
Gosh. If you get celiac, what happens is all the surface area of your small intestine is denuded. It's like there's nothing there to absorb anything. You're malnourished, you may have chronic diarrhea, you may lose weight, and once you develop one autoimmune illness, it's very likely, because there's no barrier between the outside world and the inside world to going on and developing another autoimmune condition. So there was this brilliant pediatric gastroenterologist in 2009 named Dr. Alessio Fasano, who discovered you need 3 things to set you up for autoimmunity. You need a genetic predisposition, you need a trigger or triggers, and you need a leaky gut or increased intestinal permeability. And we can identify that. And so it's all about prevention. Our society is very reactive. Oh, you've got this disease, now take this drug.
Right.
Now you've got this symptom from that drug, take this. So we want to help you be proactive and prevent it. So a leaky gut is very, very bad. And our toxin burden is so bad, it's like we're in mop-up mode all the time.
Absolutely.
Okay.
Well, thank you so much for submitting your questions. Thank you so much. We are going to be doing this. So if you felt like you watched this and somebody else would benefit from this, we're going to be doing these at least once a month. So subscribe to our channel and you'll be able to know when events are coming up, as well as check out our website and follow us on our social media platforms at gettotheroot.co. Thank you so much, Dr. K, for your time, and thank y'all for listening.
Thank
Bye.
you.